Dr. Surabhi. I am working as a consultant neurologist in Anantapuri Hospital, Thiruvananthapuram. Today, let's spend a few minutes talking about seizures and epilepsy. So, what exactly are seizures? We know that the brain is the control center of our body. And inside the brain, we have millions and millions of small cells called neurons. These neurons, they send certain chemical messengers into the brain to control certain parts of the body. So what happens when one of these neurons misfire or if they fire abnormally? Well, that leads to an abnormal electrical activity inside the brain, which leads to a seizure. So it can happen in one part of the brain or both parts of the brain. And it can manifest in the patient with the patient losing consciousness or stiffening of body or abnormal jerking of the body or frothing from the mouth, etc. So now that we have seen about seizure, let's talk about epilepsy. So a seizure can happen just once in a lifetime in a patient or it can happen again and again. So if there is a tendency for the patient to have again and again seizures or repeated seizures, then that becomes a neurological disorder called epilepsy. So how do we know that the patient can have only once in a lifetime seizure or epilepsy? So after the first episode of seizure, he has to be evaluated with basic blood test, an EEG scan, and an MRI scan of the brain. So that can give some clues towards if the patient can have an epilepsy. Sometimes all these tests may be normal, but still the patient can have epilepsy. So that is why it is important to consult a doctor, and with proper medication, the person can have a normal, happy life. Thank you.